My name is Dr. Craig Moss. I'm a geriatrician and also an internist. I'm also the managing partner of Medical Associates of the Hudson Valley, which I'm very proud of. I'm a geriatrician. What that means, I take care of older folks. I got into that in a little bit because nobody else was doing it. I thought it was an interesting field. When I was looking at what I wanted to do, sort of when I grew up, part of it was I wanted to find something that was helpful, that was meaningful, that I could feel good about, and that was also challenging. And so part of it was when I looked at that, I said, what kind of profession do I want to get into? For me, healing, my father was a physician in the area. That meant a lot, that people would come, they'd actually give him, a piece of pork or some other things, that we'd get from the house. And it meant a lot to me that people appreciated him. And obviously I wanted to be appreciated as well, and I wanted to do good in the community. So that's part of how I ended up becoming a doctor. I also was a big fan of Sherlock Holmes, and I was always like, how do you unravel this mystery? And of course, when you're dealing with somebody who comes with problems or complaints, how do you unravel that to what it means? And then how do you follow through and do something about it? Geriatrics is particularly challenging because often patients are on 9, 10 medications. They have 8 or 9 different diagnoses that come with it, hypertension, diabetes, heart disease, sometimes some memory loss. How do you put that all together? And then how do you put that together with their families? So there's a social aspect, there's a medical aspect, there's a pharmacologic aspect. Sometimes what we do is actually take patients off medicine, so they have polypharmacy, so that's very helpful. So I think at the end of the day, people are, appreciative of what we're doing. I think in terms of, how this all works, it's not just here, it's also what we've done in the community. So I feel very proud of what we've done in the community. Part of the mission of Medical Associates Hudson Valley is to give back to the community. And we've done that in a number of ways. One is the Women's Health and Fitness Expo, which was going for 17 years. It was our way of giving medical care and letting people know about different aspects of medicine. Not only medicine, but also things like chiropractor, acupuncture, anything that had to do with health. And so it was our way of having people get introduced to that for one day. In addition, here at Medical Associates, every month we do a fundraiser. So if you come to our office, you'll see that there might be a dress down day, or maybe there'll be something for cancer or heart disease or Alzheimer's. Sometimes it's even supporting staff. One of our staff, unfortunately, had a hurricane hit her house, so we're doing fundraising for that. In addition, we've done sort of some international brigades. We've gone to Nicaragua with Tulane medical students. One of the really fulfilling things about that is that when you go there, you don't have all the tests, you don't have all the specialists. You basically have about 3 tests you can do. You can do glucose, you can do urine, and you can do pregnancy. If you can't figure it out with those 3 tests, then you're stuck. So really the medical students really enjoy it because it's a time to use their brains. And that's different than what's happening now in medicine. I think often we sort of lose track of why we're healers, why we're doing all this. And often, one of my roles is actually when the patient says, shouldn't I see an orthopedic surgeon or shouldn't I see a heart doctor, is to actually say no. Because one of the reasons, when I trained, what we did as an internist was we basically said, here's your problem, and then we sort of worked through a differential. And then at the end of that, we might say, look, we're really stumped. Why don't you see a specialist? Or we really need a procedure, colonoscopy or cath, then why don't you go? So it's not sort of, I have a knee pain, shouldn't I go to orthopedics? I have chest pain, shouldn't I go to heart diet? We like to get that down to a point with whether you need it or not. For example, the heart pain may be reflux. It may have nothing to do with your heart at all. So I don't want to send you someplace that you don't need to go. And often we're doing things we call therapeutic trials. So we might put you on medication, you get all better. That's the end of the story. Sometimes we have to go further. So I also like to look at medicine as an onion. We peel back the first layer. We may have the answer, that's the end of it. If not, we just keep peeling it back and back and back. I also, from my point of view, as a primary care physician, many of my patients have been my patients for 30 years or longer, and I like to see it as sort of instead of a picture, actually a film. So I know the patients, and I know what's going on. So one person might say, I have a headache, and they've had a headache for 20 years. That may not be significant. Another person I know has never had a headache, and they have a headache, and I'm rushing them off to an MRI to look for a bleed. So that whole aspect of film. The other thing is that when I treat somebody, it's very helpful that I can say, come on back in 6 weeks, or if you're not any better, call me, or get on the portal and let me know, so that we don't have to treat you like you go into the emergency room where, rightly so, they have to order every test because they have to cover every aspect to make sure they don't miss anything. I feel like my patients will let me know if the diagnosis is wrong or they're not getting any better. And in addition, I'll often say, why don't you follow up in 6 weeks? But you know what? If you're feeling great, just cancel that appointment. But I want to make sure you're doing okay. So I think that's particularly fulfilling for me as a primary care physician, is seeing patients over time. One of the things that's unique about our practice is that we actually admit our patients to the hospital. And that's sort of fallen out of favor now as people have hospice. From our point of view, when you go to the hospital, you're the sickest. That's sort of like when you need us. If you're having a pneumonia, or you're having heart disease, or you're having congestive heart failure, you really need us to be there because we can help you through those stages. We can help you to what you want to do. Sometimes, especially in geriatrics, it may be end-of-life decisions. So you know what? We just admitted mom, she's demented, she has pneumonia, she may have cancer. How much more should I do? Well, that's very challenging if a strange doctor who you've never met comes in and maybe the next day it's a different doctor and you're trying to have that dialogue. I think patients trust me, otherwise they wouldn't continue to come to me. And so I can have that dialogue with you or your family and say, look, maybe this is the time. I'm looking after your interest. If it was my mother or my father, this might be the time that I wouldn't want to do anything more. And so I think that very much helps to bridge those very complicated, sometimes emotional times of people's lives. I guess the other part is Medical Associates Hudson Valley. I'm the managing partner. We've been here since 1984. I like to say that I have influence but not control. One of the ways that it occurs is by developing what we call a culture statement. And I'll tell you how that came about. About 8 years ago, a bunch of medical groups came into town and they asked us, why don't you join us? And we had to really ask, why shouldn't we join you? Because our lives might have been easier, they might have been financially better, et cetera, et cetera. And what we did was we sent out a questionnaire to all the staff, every one of them, the front desk, the nurses, the doctors, and we said, you know what, we're growing. What kind of person do you want us to hire? I'd been president of the medical staff and I hated these sort of mission statements. I thought they were way too vague. And so people wrote all that, and then the staff got together and actually did this culture statement, which I want to read to you because I think that this sort of is what we're all about. And when I say I have influence but not control, is I have influence in terms of trying to be the keeper of the culture statement, making sure that we have the culture statement. So one of the things that happens if you have a strong culture, you hire people based on the culture. So anybody that comes to our practice who wants to be hired, we show them the culture statement, we show them what we're about. As a result of that, we're not micromanaging the front desk. We're not micromanaging anybody. We're just saying, does it fit within our culture? And I'll give you a little side story. What happened was we had a physician, actually turned out to be an infectious disease physician, and he came up to interview, and he said, I really don't want to be in Kingston. What's in Kingston? And that's not uncommon. We're not in the middle of Boston or Manhattan. And he said, but I'll come up anyway. So he came up, saw us and so forth. And he said, I really want to be in Manhattan. I really want to be in Massachusetts rather. And so about 2 weeks later, around 10:30 at night, he calls me and he says, that position's still open. I can't get your practice out of my mind. Okay? And I think that tells a lot about the people that we attract to this practice. We're not for everybody, but we're for a certain group of people. And one of the things that I wanted to read to you was our culture statement, because I think that this is really the basis for both patients and staff coming here. So the culture statement is the following. We at Medical Associates of Hudson Valley believe in a diverse culture that strives for excellence. Our physicians enjoy practicing medicine with skill and dedication towards their patients' needs and concerns. Our professional staff is selected to serve our patients with compassion and understanding. Patients should feel confident that they will be treated with kindness and respect. At MAHV, physicians and staff work together to continually improve the quality of care we provide. Together, we embrace the spirit of teamwork, keeping an open mind and a willingness to face challenges with positive attitudes. We make every effort to do our best, recognizing our strengths as well as our weaknesses, never forgetting we are here first and foremost for our patients. Accountability and ownership are the results, attributing to the integrity we take pride in. The physicians and staff are closely connected to our community, and therefore we make it our goal to give back, participating in monthly fundraisers within the office. The proceeds are donated to our local shelters and organizations, helping to support those in need. From the first moment of a patient initializing an appointment to the completion of their visit, our dedicated team of physicians and staff committed to providing excellence in patient care and customized service. With a commitment to continually learning and growing, MAHV strives for an atmosphere where our patients are confident knowing their health care is in good hands. So one of the other things, our mascot is the purple cow. And I don't know if you or any of you know the story of the purple cow, but it's basically one where somebody from Manhattan, as you can appreciate, went out in the countryside and saw these cows. And he was just thrilled with the cows. There were so many of them. But after seeing 100 cows, he said, what's the big deal? And what he was really looking for was the purple cow. And that's our mascot, because we see MAHV as sort of a different kind of practice. And we hope that people who come here will also see it that way. That includes people who work here, as well as people as well as our patients who want to come and be treated by us. If there's ever a question or a problem, my name's Dr. Moss. I'm the managing partner. You can always get a hold of me. Our idea is not that we don't make mistakes. We make lots of mistakes. But the idea is that we learn from those mistakes. So actually, the more mistakes we make, almost the better we are. And it's not about, it's more about grabbing hold of our values and letting go of the consequences.